Number 2, the super story. The Avengers came together for this wireless retinal chip that's helping solve for blindness.
Yeah.
This is in the New England Journal of Medicine. Again, we have Science Corporation, Stanford, UCSF, University of Pittsburgh, and University of Bonn that all collaborated on this story. You were really excited to talk to me about this story.
I was really excited to talk to you about this because my undergrad PhD thesis, not PhD, my undergrad bachelor's thesis in Princeton had to do with the retina. And, you know, we were doing fundamental science, but this is a really cool story because it's out in NBC News. Fox News even covered it. With a tiny eye implant and a set of glasses, we can now cure age-related macular degeneration.
Which is crazy.
Right?
Yeah, no.
The solution is pretty ridiculous. Now, this to be mindful, this age-related macular degeneration, which is basically age-related blindness in the center of your visual field, this had no prior restorative therapies, right? This is the first of its kind that is trying to tackle that, okay?
So basically, if you had AMD, you were just...
Yeah, you were just you were just blind in the middle of your field. You could see in the peripheral, but in the middle you couldn't see anything. And now we actually have something that is restorative, right? Not just slowing it down. Restorative.
It brings it
back.
That's
okay.
Okay.
The solution is something called a PRIMA system. It's a photovoltaic retina implant microarray. It's a novel neuroprosthetic, so it's wireless, it's sub-retinal, and we're going to get into what all that means, okay? This was published in the New England Journal of Medicine. The key trial is called PRIMAvera. I don't know if the authors are fans of the music festival in Barcelona, but that's what they called it, the PRIMAvera. It's an incredible thing, okay? 81% of participants said they got profound improvement, meaningful improvement, okay? And remember those like eye exams that you had to do with like a bunch of big like letters, and then these guys, the guys who had this, over 5 additional lines on the eye chart.
Really?
Right? That's a lot, dude.
I have bad astigmatism and can barely see, and so I
and some patients regain the ability to read letters, numbers, and words.
That's crazy. Okay.
So let's talk about how the eye works, because that's gonna tell you about how the mechanism of this thing works. Okay. The eye is basically a camera.
Mm-hmm.
Okay. You've got a lens. You've got a detector in the back. Just like a camera. A camera has a lens and then a CCD in the back that the image falls on, and then the CCD captures how many photons are coming here versus there. What are the colors of those things? The eye is very, very similar, okay? The retina is an image sensor in the back. And this retina has photoreceptors, which are your rods and cones. You can think of that as your CCD. That's the thing that actually interacts with the light. And then if a little photon interacts with it, it's going to set off a little electrical signal. Then it goes through a bunch of different cells. They're called bipolar cells. Some of them are called amicron cells. And at the end of the day, you've got ganglion cells, which are the cells at the very end that take in all of that light information, convert it into electrical pulses, action potentials, and that goes through the optic nerve, through your eye, to your brain, to the occipital lobe. And that's what's transmitting visual information to the brain's visual cortex, okay? Mm-hmm. But it's like mechanistically, the eye is remarkably like a camera. You've got a lens, and that lens you can squish. There's muscles on the end of your lens that you can squish and so on and so forth to let in more light, less light. That's your aperture, right? Mm-hmm. In a normal DSLR, you've got the magnifying, right? Yeah. And the magnification is like how much, like the distance between your lens and the focal plane.
Yes.
But for us, I can focus on the microphone right in front of me, and I can also focus on a mountain that's way, way, way far away. right?
Yeah.
And the way that our eye can do that, we don't have the luxury of actually extending our lens. So what we do is we actually change the curvature of the lens
In order to do
in
so.
order to actually get different
Yeah, okay.
focal lengths, right?
I get you.
So it's remarkably like a camera, okay?
Mhm.
And in the back of your camera, in the back of the eye, you have the retina, which is this mini computer that takes in all of that information and then relays that back to the brain.
It's sort of like the processing center. Once
Yes.
once the raw data comes in, it kind of packages
Yes.
it up to send it upstairs.
To send it upstairs, exactly. And in the center of your retina, you have something called the macula and the fovea, okay? Notice, like, I want you to just do this experiment where you're like looking at stuff.
Mhm.
Notice that you have a lot of detail in the center of your vision
Yeah.
compared to the periphery,
Yeah.
right?
Yeah.
Like if you really wanted to read something like that stuff that's on over there, you would focus on it so that it's at the center of your vision.
Right.
If you focus somewhere else, you wouldn't be able to read it.
Yeah.
And the reason for that is you've got this structure called the macula and the fovea that has a high density of rods and cones, specifically cones actually,
Yeah.
that are the color receptors. So you've got like higher resolution there because the pixel density is higher.
We're not
effectively.
everything is not totally in focus
Yes.
all of the time.
Yes, exactly. And macular degeneration is actually a progressive disease that damages that macula. So
Mm.
the macula is in the middle, right? And you can have two types of AMD, macular age-related macular degeneration. There's the wet AMD, where basically the abnormal blood vessel growth, there's a bunch of blood vessels in your eyes, right, that are keeping these cells alive, giving it oxygen, things like that. Those blood vessels can leak, rapid vision loss. And then there's dry atrophic AMD, okay? And that's the gradual thinning of the macula. You get these extracellular deposits where the cells are sort of just dumping their trash, and then that kills everything. And all of that accumulation happens, and it kills all of those cones and that are there
In that center.
in that center. And so that center of the center of your visual field
Yes.
is the thing that goes away.
Which is like obviously
And that's the whole point.
Yeah, right, right,
Like that's where most of my information
right.
is coming from.
Right.
And that's the one that's more common, right?
Okay.
And then there's geographic atrophy, which it's at the end stage of AMD. You get these well demarcated patches of your retinal tissue where they die off. You get the photoreceptors that are dying off, and it results in like absolute scotoma. So you get a blind spot right in the middle.
Mm,
And when you get the blind spot, you literally can't see in the middle of your visual field,
which is so crazy.
right? It's a complete loss of phototransduction.
Mhm.
Okay. That is what this particular study is trying to handle. Okay.
Incredible.
And it's pretty common actually. Irreversible blindness among older patients globally. You've got something like 200 million people that have this. In the US itself, it's 1 million people. It's an incredibly like big problem that we need to solve, right? Obviously, quality of life
Yeah.
goes away.
Yeah.
There's a loss of independence. It's got a devastating impact on
I mean,
all aspects of your life.
especially like when, not that it's true, it's been true forever, but particularly when everything's so device driven and
Oh yeah, I didn't even think of that.
you know what
Yeah.
I mean? So it's like you have to be able to like, read and interact with screens. And so it's impossible to do so.
Exactly.
Especially in a device driven kind of era.
Yeah. And previously it was just like, oh, you're totally not having a good time. Okay. There are a few drugs. Like there's the first drug was approved in 2023, Izervay. There's another drug called Syfovre, I guess. The mechanism is you basically inhibit this cascade of stuff that's going wrong in the back of your retina. It slows the lesion growth by 20%, but at the end of the day, it's not restorative.
It's just stopping.
It's just slowing it down,
the degeneration.
right?
It's
And
just slowing.
that's great.
Yes.
But
Yes.
for someone who's already had it, it's not really doing
it's
much.
Not, it's not. Yeah.
Right? And so now we've got this PRIMA system. It's a new paradigm in vision restoration.
Okay.
It is restoring things. Okay. It's got two primary parts.
Okay.
There's an internal component. There's a tiny photovoltaic implant. Okay. It's a little cluster of neuro implants, right? It's a tiny little electronic device at the end of the day that goes in the back of your head. Okay. And it surgically gets placed in the back of your retina, in the back of your eye. And then there's an external component, which is specialized glasses with a video camera. And what that video camera is going to do is project light through your eye to that implant in the back of your retina and stimulate that implant to create electrical signals to trick your eye into thinking your photoreceptors are still alive.
That's okay. So the idea is you have this two-part system, which is effectively mimicking the real effect of photons hitting the back of your retina. But because all the stuff in the macula is now dead, we're not like regenerating the cells itself, but we are creating a synthetic version of the exact same input, such that when it goes into your brain, it's receiving an identical signal to what you would in a natural sense, but in an artificial. Very interesting.
It's like simple, but at the same time, extremely hard to do.
Obviously, because it hasn't been done yet.
And it's only being done because of today's technology. So now let's tackle the implant. Okay? What is the thing that is going in the back of your eye? Okay. It's a 2 nanometer by 2 nanometer little chip. Okay. 30 microns thick. It's a silicon chip. It's a pixel array of 378 different independent hexagonal chip pixels. 2 nanometers by 2 nanometers. It's way smaller than a penny. It's like smaller than even Lincoln's. It's like the size of Lincoln's eye
on the penny in the Lincoln Memorial.
That's how small this thing is, right?
Small.
Each of the pixels, there's 378 pixels. Each of those pixels has a little mini solar panel and an electrode. Now you're thinking, why solar panels?
Yeah.
Well, solar panels create electricity out of light. Now, I've created electricity from the light that is going into my eye. I don't need an external battery or anything like that.
I'm so mad.
I thought that was so cool,
That's
dude.
so genius.
I thought that was so cool.
Which matters because a lot of times you can even use phones as an example. A lot of the weight that goes into the phone is the battery.
This is the first one that is wireless. The reason why it's wireless is because they use this photovoltaic cell.
That makes sense.
Right?
That's genius.
And I think that's so genius.
Yeah, that's
right?
smart.
Like there's an electrode, and that electrode is what's actually creating the electric field to then tag all the other neurons in the retina to make it seem like, right? There is a photoreceptor there. There's a rod and cone there. But the energy for that electricity is coming from the photon itself.
And it makes sense because your eyes are, anyway.
Right?
Yeah, that's smart.
That's so smart.
That's very smart.
That's
I like
so
that.
smart. I love that.
Like that
and as soon as I saw it, I was like, oh, that's dope. That's dope.
That's good.
Yeah. And so what they do is they take this little chip, 2 nanometers by 2 nanometers, and they put it under the retina. Okay. This is deliberate where the electrodes are in proximity to the bipolar cells. So it's where the photoreceptors would be. And there you can see on the left, you've got a giant patch of where the photoreceptors have died. You're putting that chip right underneath where those photoreceptors should be. Okay. And that chip is now going to stimulate those bipolar cells, which will then in turn stimulate the ganglion cells, which will then go all the way to the back of your brain, right? It's natural, it's efficiently processed signal, and it's more sophisticated than these older retinal implants that were stimulating the ganglion cells that were directly going into the brain. These guys are mimicking the photoreceptors
itself. Yeah.
You see?
Yeah.
It's so nice, dude. I love that. And what I love about this as well is that so the pixel has an input. So that's where the source of the electric field, like the source of the current, but it's also got a sink. Because if you don't have a sink, then you put a lot of current out. That current is going to spread out, and it's going to trigger all the rest of the cells everywhere else in the retina. But if you have a sink, then it becomes localized. The current goes out, it triggers the stuff in its neighborhood, and it goes back in.
It becomes it becomes discrete.
Exactly.
Yeah.
Exactly. So now your pixel size, right, for like what I'm trying to see, that becomes smaller.
Oh,
they've thought of it. They've thought of everything, mate.
This is really
it's
good.
really nice.
This is really
right?
good.
Okay, so that's the implant.
Okay.
Now let's get into the outside, right?
Yes.
There needs to be something that actually goes and puts light to that chip that's in the back of your retina.
Yes.
Right? And that's where these glasses come in. So there's a user interface, there's a smart component. You put on these glasses. You also have a user interface, like it's kind of like a remote. And that's your user interface that you can like zoom in, zoom out.
Ooh.
Yeah. You can adjust the contrast and things like that. And then your glasses, they've got a little video camera, kind of like the Meta glasses, you know, the Meta glasses have a video camera.
Yeah.
And those glasses then send in near infrared signals to the back of your retina, which is where the chip is. Why near infrared? Well, all the other natural photoreceptors in your eye are not sensitive to near infrared. Right? If you were sending in visible stuff, then you'd be blinded by like a giant like flashlight that's like right next to your eye. But because it's near infrared, the only thing that is getting stimulated is the chip.
Is the chip itself. That's actually
that's
really good. No, that's really good.
It's so nice.
I'm
right.
Yeah.
You're seeing why I was excited about this. This is so cool.
I'm like I don't have anything to say because it's so good.
It's so good. Like they thought of it, right?
It's so good.
The fact that it doesn't have any cables, like usually these things used to come with cables, but the fact that it doesn't have any cables simplifies the surgery. So you can go into the corner of your eye. I mean, it's still a crazy surgery. I'll be honest. Like you're going in with a needle in the corner of your eye, but you're depositing it in the back of your eye. But it's a relatively simple surgery because all you do is you stick it in, you leave the little bit of chip where you want it to be, and then you take the needle out, right? And it's actually incredible. This chip efficiently absorbs 30 microns of silicon photodiodes, right? It's 30 microns of silicon photodiodes. You get this pulsed light that's coming in at 30 hertz, and 30 hertz is, you must know, 30 hertz is about where film
exactly
frame rate is. And that's because the ganglion cells that are going to the back of your head, right, that are relaying this information, anything faster than 30 hertz and it's really not discernible. Anything slower and it would look like stop motion. So at 30 hertz, you're getting this flicker-free image of pulsed light that's going in.
This is really clever.
Bro, it's so cool.
This is really, really, because you have to both solve for the like technical, so there's a variety of stages of this process, right? There's the actual like, where in the eye do you make the intervention in order to get the restorative benefit? They made that sort of innovation by putting it in that like where the cones and rods are.
Yeah.
Then you have to think about how do you get power?
Yeah.
Then that's the solar piece.
You made a solar cell.
Which is so brilliant. Then you have to think about like how are you actually going to turn it on? Meaning like how are you going to direct the light to make it actually work the way you want it to?
But not affect
everything else. And so the near infrared as the methodology to do so is so genius.
Yeah, dude.
Oh man, that's so good.
It's so good.
That's quite nice.
It's so nice.
That's quite nice.
Yeah, it's so nice. And let's talk about the study itself that came out in the New England Journal of Medicine, right? Okay. It's a multi-center, so 17 sites across 5 European countries. You mentioned the University of Bonn. I mentioned them specifically because they kind of did a lot of the groundwork, but a bunch of other European institutions were part of the clinical trial, right?
Sure.
But you're increasing generalizability because of these 17 different places are trying it.
Because people culturally, genetically, you want to have it spread across a variety
Exactly, yeah. So 38 participants, all of them over the age of 60, and all of them confirmed atrophy in both eyes.
Okay.
Right? And what they looked at was something called the log-MAR, which is the logarithm of minimal angle of resolution. It's effectively saying, like, in the center of your field of vision, like how big can you see things? It's this thing. It's the letters and the driving test. You know, when you go to the DMV and you're like, okay, can you see or are you blind? Those letters tell you how small of a letter you can discern.
What line can you see on this one?
Bro, I mean, the screen is pretty small, but I think I can see that. but in any case, these guys, after 12-month follow-up, after getting the implant, 81%, so 26 out of the 32 participants met the endpoint, highly significant, and it's equivalent to 5 lines worth of stuff. 59 more letters than they could have originally in that eye test, you know?
I mean, this is such a huge, I mean, we talk about this all the time, which is like why, you know, these studies are so important. Like the unlock that you get from something like this, for a huge population of people who otherwise were just going to lose the ability to see.
Yeah.
Permanently.
Yeah.
Is now no longer like necessarily true.
Yeah, dude. There was one dude who went from legal blindness to like, I can drive now.
That's crazy.
I mean, that's one dude, but still, like,
No,
yeah.
and this is like this is V1.
Yeah.
Right.
Yeah, this is V1.
It's the first iteration of this, in which you now have, I think that the innovation is in like all the kind of steps we just talked about, because now you can iterate on each of those component parts for any number of different permutations or use cases, etc.
Exactly.
That's a really, really interesting.
It's really cool. I mean, there were detractors. Like if you looked at user satisfaction, 69%, so 22 out of the 32 reported medium to high overall satisfaction, which it's still like if you weren't able to see and now you're able to see, like that's 30% being like, I'm not satisfied. And I looked into more of that. I think part of that is because of these things called serious adverse events that happen at the end of any surgery. Yeah. Like you're sticking a needle into someone's eye, and you're putting in a chip. Like there's gonna be serious adverse events, right? Sure. Most of the stuff had to do with the trauma and healing from the surgery,
not from the actual
device, right?
Itself,
so if we can make that process better, perhaps this can be a lot.
The satisfaction
better. The satisfaction can be higher, right?
Which makes sense. That does make sense.
But at the end of the day, I think like this PRIMA is a quantum leap in terms of retinal implants. Like before, the first FDA approved retinal implant was something called the Argus 2, which had 60 electrodes.
That was this image I just pulled up earlier.
Yeah, and that was wired though.
You're right.
Okay,
you can see it coming out of the.
Yeah, and you could see that like in the retina itself, there's a little like wire that like. Right? This thing is just complete. It's just a chip naked on its own.
Wireless,
dude. Wireless, no battery.
No battery.
It's just a photovoltaic cell.
It's so clever.
It's so clever, dude. And what they're doing next, you talked about how this is just the beginning, right? These pixels are about 100 microns in size. Mm-hmm. They're trying to get it down to 20 micron. Mm-hmm. 20 micron pixels from 100 microns. So now we'll be able to fit 10,000 pixels instead of the previous 378.
Yep.
So now I'll be able to get as much fidelity as I do now.
Which is, and again, now it's become an engineering problem.
Yes.
Which is like much easier to deal
with. Yes.
Like I'll take an engineering problem all day.
Yes. 20 microns, right? That's about the size of the rods and cones themselves, right? You're now starting to get to the limit the biology was getting to. Mm-hmm. Obviously, there's going to be challenges, right? You can't, smaller pixel size means that the electric field penetration to the upper layers of that retina is going to be not as good. So maybe you need these 3D electrode structures, right? Where you have like pillars, right? Where the pixel is like this and you've got a pillar that injects electricity into the upper layers of the retina. But again, engineering
problem. Which is infinitely more solvable,
dude,
than going from 0 to 1.
Mm-hmm. I mean, this thing is like decades in the making, you know, but it's working. And it's so clever. I loved it.
Yeah, no,
Yeah.
that's really.
It took
really
a while to get access to the paper.
Oh, yeah,
it was
yeah,
in New England Journal of Medicine. I don't know why you guys. Yeah, like, I don't want to pay. Like, I think it was like $100. I'll be honest. I think it was like $100. So I asked a friend of mine who is a doctor who does research, and I was like, hey, I need you to give me a PDF.
We're trying to give you guys some traffic here.
Yeah.
Okay, we're trying to give some promo.
Yeah.
So free advertising.
Yeah,
on the First Principle Pod. We'll do deep dives on the
they're
stories.
like, who are you?
And like honestly, like give like good understanding, because a lot of times, again, like for the average person, it's hard to really like parse and decipher what's actually happening in these stories and like what the implications are and what's like the real world, meaning. And the real world meaning for this is like a big deal.
Yeah, this is a big deal, right? Like now, imagine in the future. Right now, I'm thinking you can bring AI into it,
Of course.
right? You could have like the Iron Man thing where like the thing automatically zooms.
Yeah.
So you don't have to press a button to zoom.
exactly.
It'll just know what you're looking at and zoom in.
Yes.
Like
Yep. No, I mean it kind of like ties to the first story we had around how AI is now being used for cancer detection. I mean, there's going to be clever ways in which to implement it in this context.
Yeah.
I mean, there's all this stuff. I mean, these implants and these things. We've talked about Neuralink before on the pod. Now we're having these retinal implants. There's a bottleneck around the surgery process itself. Like we're still, meat. We're still meat sacks.
Yeah.
And so that's still a bottleneck.
Yep. It's still a bottleneck. Yeah. And it's going to be for a while.
But we're getting into real interesting places. I mean, as someone who already has bad vision, my wife has bad vision too. She actually has. I didn't do LASIK or anything. I just wear contacts and glasses.
Mm-hmm.
But her vision was so bad that at the time, like LASIK wasn't good enough for her eyes. So she got the implanted contact lens.
Oh,
like in her eye.
Wow.
Which is like, and I was like, they could.
That's crazy that you can do that. I know.
And this was like 15 years, whatever ago. This was a while ago. And at the time, it was state of the art and this and that and yada yada. But I mean, this is like orders of magnitude
crazy,
more difficult than just embedding a contact lens, in the eye. Fascinating.
Yeah, I thought that was
That's a great story. That is a great story. It gives me hope that if I start getting blind later in life, there's still a chance.
Yeah, there's still a chance.
There's still a chance.
So you're saying there's a chance.
You're saying there's a chance.